Hi, I'm Katlin Simm, third semester nursing student. This is my video for blood administration. There is my setup. Blank board. Other blank board. Door. Knock knock. Sanitize as I walk in. Provide for privacy. Hi there, my name is Katlin. I am a nursing student working with your nurse today. She has asked me to start the blood for you. She went to the blood bank to get the blood. Before we get started, I am going to verify a few things. Can I verify your name and date of birth, please? On the MAR, I have Betty Jones. That's on her armband as well. 5/21 of 52, and that's what she tells me. Okay. While she is going to the lab to get that, I will set up the IV blood tubing and check the patency of your IV. So I'm going to take my alcohol swab, clean the site, take my saline flush, attach it, make sure the lock is off, and that is patent. Take that off. Then I'm going to set up my tubing. So I'm going to have normal saline. There's no punctures or anything in the bag. It's not expired. Got my blood tubing here. I'm going to take this and spike the bag, hang up the saline, open up all of my ports, and prime the tubing. Make sure saline gets all the way down. And it's primed. Make sure my other port is primed. It is. While we're still waiting for the blood, I'm going to take a listen to your heart and lungs. Breathe normally for me. Sorry that that's cold. Okay, thank you so much. Take a set of vitals on the patient. Basically get a baseline of what they normally are. Explain to them the reactions that could occur. Mild reactions include IV site reactions such as itchiness, swelling, redness. More severe reactions could be shortness of breath, chest pressure or pain, back pain. Oh, look, there's my nurse with the blood. please verify this with me? Oh, certainly. Okay. I have the consent here. That's taken care of. I checked the line for patency. It's good. And the tubing is primed. That is great. Now let's verify the blood. She has the blood. I have the MAR MedRec number 224466. She says 224466. Location HLRL. She says HLRL. Account number 123456. She says account number 123456. Patient name Betty Jones. This is Betty Jones. The red armband number is 456654. I have red armband number 456654, and that is what I have on her red armband on her arm, 456654. That is great. Okay. Blood type. Her blood type is B positive. The blood type on the blood bag is B positive. The donor pool number is 7890. The donor pool on the bag is 7890. I have 4 units in the pool. There are 4 units in the pool. The volume is 250 milliliters. The volume of this bag is 250 milliliters. These are packed red blood cells. Packed red blood cells. That's what we're expecting. Expiration date and time, 6/21/22 at 1500. 6/21/22 at 1500. The donor blood type is O positive, and the donor blood type on the bag is O positive. Compatibility type and screen was done on 1/21/22 earlier today. And since we're starting this right away, we don't have to worry about sending it back to the blood bank because we're using it within 30 minutes. I'm going to sanitize my hands since I'll be working with blood. I'm going to apply some gloves just in case. I'm looking at the blood. Doesn't look like it's clotted or has anything floating in it. No holes in the bag. Looks good to use. Got my prime tubing. I didn't have that clamped. I'm going to spike the bag. Clamp the saline. Start turning on my pump. Sometimes it takes a little bit. I'm going to prime the blood in the tubing. I want to actually infuse blood within the first 15 minutes. I start to see pink. So I clamp that. Select channel. I'm going to go with this channel just because. Guardrail IV fluids. Page down till I find blood, red blood cells. Yes, that's what I'm infusing. Just verified all that information. Open it up. Place it in. Close the door. The rate want to start infusing it is 50 mLs an hour. $50 an hour. And the volume, I said the volume was 250 mLs, but I'm going to do 200, just so my tubing doesn't run dry. I'm going to clean the port on the patient with alcohol. Since I just dropped this on the floor, I'm going to clean that with alcohol too. And then attach. Make sure all my clamps are open. And start. I'll stay with the patient for the first 15 minutes, take a set of vitals. As long as there is no reaction or adverse reaction to receiving the blood, I will come back and get vitals every 15 minutes for the first hour, and then before I leave the patient, I'll increase the rate to what is appropriate for the patient. And then the blood isn't able to hang longer than 4 hours. If it does, then I have to change out the tubing. Then I clean up my supplies, remove my gloves, document all of the information that was on the transfusion worksheet, and the date, time of administration, where it was, where the IV is that it was inserted, what type of IV it was, if it was a PICC line or a peripheral or central line or what have you, and how the patient responded to it, how much saline was used in the flush to check the patency of the IV, and that is blood administration.